who are an ideal candidate for bariatric surgery?
There are multiple different concepts. There is weight loss, there is inch loss, and overall we're talking about fat loss.
Weight reduction, inch reduction from all over the body by a body contouring surgeon, complete no.
After bariatric surgery, especially if the patient is unable to exercise adequately, that is when we ask our plastic surgery colleagues to come into view.
We sculpt a kind of a figure out of a fatty blob. If the weight is more than 120 kgs, then bariatric can be the first go. Surgery is not an endpoint to your weight loss journey.
This is where all bariatric and plastic surgeons tend to become a lot of psychotherapists as well.
Even there are certain individuals, those who come to us having a pre-diabetic status. The moment we remove even 2 to 3 liters of the fat, and then you can control certain diseases.
One shoe size cannot fit everybody. Same formula cannot be applied to an entire population.
The idea is like what is going to suit you. There is no single key for all the locks. All the doctors are really focusing upon educating, sharing their knowledge. Surgery ho gaya mera, now I can do anything. It's never going to be like that. Otherwise, you are your own boss and we are not going to be there in your journey at all.
Hi everyone. It's my great pleasure to introduce to you today Dr. Umang Kothari. He's a board certified plastic surgeon and the founder of Hair and Shape Clinic here in Mumbai.
Hi guys, and today we have Dr. Nidhi Khandelwal with us. Dr. Nidhi is a very good friend of mine and an excellent surgeon, and she is a laparoscopic, bariatric and a robotic surgeon working in South Mumbai. The question here is weight loss versus the inch loss, and then as a two consultant who are offering weight loss journey or an inch loss journey to the population or to the patients, this is the most commonly asked question, or this is the most confusing thing. I, as a plastic surgeon or as a body contouring surgeon, see a lot of individuals who are an ideal candidate for bariatric surgery, and they accidentally they land up into my consultation and they actually require proper bariatric care. And I'm sure that will be the experience with you, Nidhi.
Absolutely true. So very often we tend to get this reverse flow of patients. So very often I would get patients, and especially women, who would just want to get rid of fat just around certain portions of their body. And these are patients who would be better suited for body contouring as compared to a bariatric procedure.
So I think as I and Nidhi had started a kind of a combined clinic even before, and we were thinking about addressing all the body needs together, like an obesity clinic and holistic approach, coming back to the same thing, integrated, holistic, multidisciplinary approach. It's what is required in today's era, where the individual seeking for all this help should know all the possible options. We can only give them the options, the pros and cons of each and every option and the success rate, and make a customized plan for that particular individual. And some of the individuals, they may opt for bariatric first and body contouring later, and some may opt for body contouring first and then they may think of going for bariatric as well.
So the basic idea is to just have this wholesome, compassionate care towards every patient, and at the same time make sure you're doing what is medically correct for every patient.
Yeah, that's right.
So here what you need to understand is there are multiple different concepts. There is weight loss, there is inch loss, and overall we're talking about fat loss. Now when it comes to weight and fat distribution in the body, whenever you've got weight which is essentially visceral fat, that is what is metabolically very dangerous for a human being. So now normally this visceral fat is the kind of fat which is deposited all around your organs, especially in your abdominal cavity, and a little bit of this visceral fat can also be found in the neck region, and that can cause a lot of trouble when you're falling asleep at night. Now these are the issues, when a patient has any of these concerns, that is when they would probably be a little better suited for a bariatric procedure, because they need to lose all this harmful fat first. Whereas in contrast, if you've got a patient who's got a lot of peripheral fat, say for example on hips and thighs, which are very common problem areas for women, those women might then be better suited for liposuction or body contouring surgery.
That's right. That's very well said. There are some stubborn fat for sure, and you have to understand the metabolism. Each and every individual will have a different kind of metabolism. Some people are really lucky with their metabolism, and by only diet, exercise and lifestyle change, they can shed off good amount of kgs or pounds. At the same time, even after the weight loss procedure, which is a bariatric procedure or some minimally invasive gastric balloon or something like that, they may lose certain weight, but they may struggle in losing certain kind of weight. And that's where the role of a consultant board certified plastic surgeon comes, where we can take care of the localized area. We can take care of the particular thighs or the arms or the back or the abdomen area, and can take care of the body contouring or the stubborn fat.
Correct. So this stubborn fat is probably what falls more into the plastic surgery category, and not something which bariatric surgeons should ideally be dealing with. But yes, it is a big consequence after bariatric surgery, especially if the patient is unable to exercise adequately. At that point, that is when we ask our plastic surgery colleagues to come into view.
And very frequently in my cabin, those who get motivated by certain Instagram reels or certain YouTube videos about the plastic surgery is all about the weight loss, and they come to my cabin and they tell me, doc, I want to get rid of everything, arms, thighs, tummy, back, neck in one go. And it's not possible. It's not possible, not advisable, because we will do more harm to your body than the benefit. Now at the same time, suppose if you have lost 35-40 kgs and if you are medically fit, have some good proteins and the hemoglobin levels, then we can consider doing some touch up and touching all the areas. But weight reduction, inch reduction from all over the body by a body contouring surgeon, complete no.
Absolutely. And in contrast over here, for bariatric surgeons, we want to operate on patients who've got global obesity, because these are the patients who would probably benefit maximum from this kind of a procedure, wherein your own brain decides exactly where all it needs to lose all the excess fat from. And once the patient manages to come down to a metabolically good weight, that is when we call a plastic surgeon.
Yes. It's a myth. Plastic surgery can never ever replace the weight loss. I have always said that the plastic surgery is an inch loss procedure, or a body contouring is an inch loss procedure and not a weight loss procedure. Weight is the byproduct. And to give you a simple example, that we are sculptors. We sculpt a kind of a figure out of a fatty blob, and we put our strokes in a such a fashion that we can create some nice curves and the negative and the positive shadows. The stone chips are the byproduct. That's not what we aim for. We aim in sculpting your body. Similarly, while achieving the inch loss, the fat reduction is the byproduct, but that's not my primary aim when we start doing the body contouring procedure. So plastic surgery can never replace a weight loss journey.
At the same time, I should also tell you a little bit about bariatric surgery over here. As much as we want to achieve weight loss through bariatric surgery is essentially designed to be a metabolic procedure, which means we are targeting all the comorbidities which enter your body because of obesity itself. So just by virtue of losing even 5 to 10% of your excess body weight, you can actually land up controlling a lot of your medical issues such as type 2 diabetes, hypertension, hypothyroidism, all of those things. Now, after you undergo a bariatric procedure, as you lose weight, all of these things keep improving. But at the same time, you have to still keep putting in a lot of efforts to make sure that these weight loss efforts are maintained by you.
Yeah, even there are certain individuals, those who come to us in a proper metabolism but having a kind of little bit pre-diabetic status, and in which the moment we remove even 2 to 3 liters of the fat, there's a good amount of metabolic change, and then you can control certain diseases. So yes, it, as rightly said by Nidhi, that a weight loss journey is never a kind of an end point, or a surgery is not an end point to your weight loss journey.
Right. And as Umang mentioned, we're talking about, the basal metabolic rate of a patient, and we're talking about how active their metabolism is. Very often, many of us are actually very poor in terms of our metabolic status. But the good news is that there is a way to improve your own metabolism. If you just start to eat right, which means you start focusing on your protein intake, and at the same time you start exercising properly and building up your muscle mass, automatically your basal metabolic rate will start to go up, which will make sure that you have a much better lifestyle.
Yes, yes. There's no right sequence. If you ask me, there's no right sequence. The right sequence is what a consultant and the patient both decides and mutually selects a path. And more than that, more than the sequence, there is a science behind this. The BMI, the weight, the somatic fat or a visceral fat, the biochemistry, the metabolic disorders, these are the areas on which we think, we discuss with the patient, and then finally on which we decide that what would benefit that particular individual in the first go, whether bariatric or a body contouring. So if you ask me a one single straight question, then it is there is no sequence like this. It is patient dependent and what kind of category he or she is into, and then make a customized plan for that particular individual.
True, so this is something which is very true of metabolic science and overall medical science as well. One shoe size cannot fit everybody, so the same formula cannot be applied to an entire population. Okay, so that's why every patient, whenever they walk into our clinic, we have to individually assess each and every one based on so many more factors, and effectively eventually just come down to a proper conclusion based on what you can offer to the patient, and at the same time what is acceptable to the patient and their family as well.
Let me give you an example which the audience will understand this in a better fashion. Now imagine someone who is 150, 160 kgs, and then he wants to start the journey, and if he is going to come to my cabin, the ideal answer for him would be to go for a bariatric surgery first, maintain the metabolism, maintain the weight, have a good stable weight after the bariatric surgery. Eventually he or she may get a loose arm, loose breast, loose tummy, loose thigh and a loose face, and then the role of a plastic surgeon will come into the picture, where we are going to tighten the troublesome areas for that particular individual. It is not a thumb rule that we are going to do all the body contouring procedures in a post bariatric individual. So yes, to make it more simplified, if the weight is more than 120 kgs, there is a lot of visceral fat, there is a lot of systemic problem, metabolic problem, then bariatric can be the first go, along with diet, exercise and lifestyle. And if the weight is 100 kgs, 90 kgs, 80 kgs with some localized lipodystrophy or a fat accumulation, then you can think of undergoing the body contouring procedure first, and then if required, maybe bariatric may help you out to make you go leaner and more leaner.
Umang, I really loved how you mentioned diet, exercise and lifestyle, because I think this essentially forms the foundation of any kind of procedure which either you or I would perform. If a patient is not willing to understand and is not willing to be compliant with all of these lifestyle changes, then very high chances that these procedures may not work in the desired fashion for them.
Yes, and I give this example to everyone. Now imagine someone undergoing the bypass graft for the cardiac surgery, and you don't expect them to have an unhealthy lifestyle after undergoing the bypass graft surgery, or you don't expect them to have a smoking habit saying that ab surgery ho gaya mera, now I can do anything. It's never going to be like that. Or after undergoing some liver transplant, you can't expect them to have lots of drinks saying that okay, now I have a new liver. No, it's a complete no again. I would say the public awareness, which I am really focusing upon, like all the doctors are really focusing upon educating, sharing their knowledge and keeping the expectation very realistic in the population, in the patients. So setting up the goals, I think if you can do that by your own diet, exercise and lifestyle change, you don't require any surgical, non-invasive or any other intervention. You can do it by yourself very gracefully. If there are certain areas which are making you look in a certain fashion which you don't like, then we are here to help you out. Otherwise, you are your own boss and we are not going to be there in your journey at all.
So again, this is such a multifaceted question, and this is where all bariatric and plastic surgeons tend to become a lot of psychotherapists as well.
Yeah.
We have to do a lot of hand holding for these patients, help them, counsel them a lot in detail, because for such a long time they've been following so many incorrect habits.
Absolutely.
And been taking unsolicited advice from a lot of other people.
Yes.
And making sure that they once again start thinking in the correct direction, especially letting go of all sorts of negative thoughts and coming back to that positive mindset. That is what is the biggest challenge for us, and that is what we try to achieve here.
Yes, yes.
Okay, so it's just like how we spoke about lifestyle. While lifestyle forms the foundation of any kind of procedure, lifestyle also forms the foundation of any kind of pharmacological treatment. Now, whenever we talk about treating obesity as a disease, which it is, we first talk about lifestyle changes, followed by some pharmacological treatment, followed by surgery in a select number of patients.
Yeah.
Now, this does not mean that Mounjaro or Ozempic should be tried by absolutely anybody who wants to lose weight. There are certain specific indications and certain specific scenarios for which these medications would work beautifully. Say for example, somebody who's in that BMI range of around 28 to 32, 35, and they need to lose weight, and at the same time they're suffering from diabetes. That would be a very ideal BMI range for a patient who do very well with these kind of medications, where they don't need to lose maybe 50-70 kilos of excessive weight, but only need to lose maybe 15 to 20 kilos of excess weight.
Yeah.
That is when these medicines would actually work beautifully. Having said that, it's not that these medicines don't come with side effects which are quite similar to that of bariatric surgery. They also do tend to cause nutritional issues, some GI issues. They can also cause a lot of hair loss in many patients. That is why all of these always should be taken only under proper supervision. Of course, once you cross that threshold of BMI, which is beyond 35-40, that is when these medicines start to become less and less effective. You can always try these medicines, there is no problem with that. But the fact is, you have to think about what your end goal is. If from 40 you want to come down to a BMI of 23, 25, you're not going to be able to achieve it so easily with these medications. But with bariatric surgery, yes, you can. At the same time, if at a 30 BMI I perform a bariatric surgery, then I would be extremely incorrect, because these are the people who would actually benefit a lot from some pharmacological therapy, because surgery would be an overkill for these people.
Yes, and I think to summarize this is the patient selection. Like I am telling this to so many people coming to my cabin, that Mr. Dhoni is Mr. Dhoni because he knows which shot selection to be done in that particular scenario, in that particular fraction of seconds. Otherwise, the training is for every batsman, and that's where the role of a consultant is going to be in your life. We have medical treatment, we have minimally invasive treatment like gastric balloon, we have bariatric surgeons, we have body contouring. The idea is like what is going to suit to you, and we have done the studies for that. You don't have to take care of that, you just have to make up your mind, do your own efforts, and then if you need, you can consult a proper consultant who are dealing with this day in day out. So patient selection, treatment selection for that particular patient, that's what we always aim about. And along with that, your own efforts of lifestyle modification, and that's how you are going to achieve your goal. In my practice, we have done so many of body contouring procedures, and some of them have actually started with medical management by Ozempic and Mounjaro, and they are achieving that remaining 4-5 kgs which they couldn't by their own efforts. Similarly, there are certain individuals, those who will undergo bariatric first and then they will come to me. There are certain individuals, those who have come to me and then they got motivated, and then they have started their journey with aggressive lifestyle change, and then they have achieved the results. So there is no single key for all the locks, as Nidhi rightly said. And I think with this, let's end up this discussion on fat loss versus inch loss. Thank you.
Fantastic. I think, Umang, you very well summarized it all, and I think effectively what the patient really needs to take home from this is that make sure you're consulting your surgeon properly, and make sure you ask all the questions and clear out whatever doubts you have in your mind. And at the same time, even after you go back home from a consultation, please go back and read yourself.
Oh, yes.
Try and understand your own body and be a little mindful of what you consume and how you land up exercising and spending your entire day.
Yeah, know your surgeon well, see for the qualifications, see whether they are the right qualified people suggesting you the qualified procedures or a surgery. Just don't go to anyone blindly and give your body and trust someone who is not qualified and just surrender your body to them. That's complete no again. Thank
And
you.
eventually know your body very well too.
Yeah.
Thank you.
Thank you.